Ava, the holidays pose extra stress for anyone dealing with alcohol or drug addiction and recovery. And that's the topic of our Maryland Peace of Mind segment this morning. Joining us is licensed social worker Bryce Hudak. Bryce, tell us where you're from.
I'm the clinical director from University Psychological Center.
What do you find I'm sorry, go ahead.
I was saying good morning and thanks for having me on this morning.
Oh, good morning. Thanks for being on. Tell us some of the things that you're hearing from some of your clients right now.
Holidays are it's a tough time for a lot of people. There's a lot of social pressures, a lot of parties, a lot of gatherings, a lot of pressure for individuals who are in early recovery to use. It can be a difficult time. I think even with the pandemic, there's still a lot of people that are still healing from some very difficult times. And so, it's a big time for need for both friends, family, a lot of support and professional help as well.
And if you're battling something like drug and alcohol addiction, I mean, especially alcohol, ads are for it everywhere. It's in every holiday movie there is. It's in every gathering you go to. What do you tell your clients dealing with all of this?
Set boundaries as best you can. Try to notify people where you can. If you are in early recovery, what boundaries are most helpful. If you need to stay away from different individuals or different parties, that's kind of what you need to do. You can love people from a distance. You can have different gatherings where maybe they're sober, maybe where people are limiting the amount of booze or alcohol that are there. But setting boundaries is one of the best things that individuals can do when they're going around others, in this time.
And there are still barriers when it comes to being able to get help through this pandemic. Finding a counselor can be very difficult right now. Finding a therapist can be very difficult right now. What do you suggest?
Maryland has a helpline. You can go to 211.org or call 211. You can look at resources that way. Finding a therapist, finding a good program can be difficult at times, but there's a lot of programs out there. You can go also to the Maryland or mdcsl.org website to look up different resources. But getting professional help when you need it is really important. You also have NAAA meetings, other support groups in the community. Utilizing friends or family if you can't access those services. Telehealth has been a great way to really cut down on boundaries throughout this pandemic, but getting in-person services has still been limited. People need that in-person contact and need that physical touch sometimes. But it's definitely very important to seek out those professional resources when you need them.
And when do you see that in-person barrier going away? And I know it's really kind of up to the therapists themselves whether they want to see patients in person or still continue to do telehealth, but some people do much better in person than they do just like this through a Zoom.
Yeah. I can tell you with University Psychological Center, our program, we have been trying to push more for in-person services. It has been a little difficult. I think with vaccination rates going up, that will help with, hopefully getting some more in-person services, but we do see numbers still going up in the community, which, can be alarming for many. But, utilizing telehealth where you can, if you need to, but, really trying to encourage other programs and providers to, look at different options for providing in-person services, even if that's mass and we can't, really look at facial expressions and, other things that we're accustomed to in the in-person world. But you have eye contact. You can look at other ways to hopefully read people and understand emotion. But finding any way to really cut down those barriers is important.
All right, Bryce Hudak, thank you so much for joining us this morning. Really appreciate it.
Yeah, thanks for having me.
Oh, you're so welcome. And if you need help with addiction or other mental health issues, your primary care provider should be able to guide you to some of those appropriate services. But 211 Maryland is also available 24/7 for a referral. If you dial 211 and press option 1, that will get you to somebody. We also have a growing list of mental health resources on WBALTV.com. Just click on Maryland Peace of Mind.